Hello, my name is Patricia Oliva and my partner is Emmanuel Avila, and our presentation is on childhood overweight and obesity. Childhood obesity is a complex health issue. Overweight and obesity are defined as an abnormal or excessive fat accumulation that presents a risk to health. It occurs when a child is well above the normal or healthy weight for his or her age and height. How this is measured is using the BMI, which is the body mass index. This is just a simple index to classify if a child is overweight or obese. It could be done by dividing the weight in kilograms by the square of height in meters. A child would be considered overweight if his or her BMI index is above the 85th percentile and lower than the 95th percentile. A child would be considered obese if his or her BMI is above the 95th percentile. To the right, we see the BMI chart where we can determine if a child is obese or overweight. The yellow would obviously be considered overweight, which is at risk for being obese, and the red would be obese. Obesity is also linked to chronic diseases. Here we see that these include pulmonary diseases, gastrointestinal, renal, musculoskeletal, neurological, cardiovascular, endocrine, and psychological. The more serious effects of childhood obesity are cardiovascular diseases like strokes and other heart disease, musculoskeletal diseases, particularly osteoarthritis that occurs when the flexible tissue at the ends of the bones wear down, and cancer. To the right, we have a chart that explains the extended growth in spending by disease. Childhood obesity is a problem that affects today's economy. In the US, childhood obesity alone is estimated to cost $14 billion annually in direct health expenses. This includes prescription drugs that are assigned to each patient, the use of emergency room, and operating rooms. When looking at inpatient costs, this will make up $237.6 million. This is the time that the patient will stay at the hospital until the time he or she is discharged. Globally, childhood obesity affects low and middle income countries, particularly in urban settings. These countries do not treat childhood obesity as a major problem as they should, so this means that they are not heavily affected economically by it. When looking at obesity in the environment, it is important to look at obesogens. Obesogens are artificial chemicals that, when they enter the body, they can disrupt its normal function. They can interfere with the body's hormones, disrupt its normal metabolic process, and promote fat gain in the body. This is a pie chart of various chemical and non-chemical stressors related to childhood obesity. The shades are blue are chemical stressors or obesogens that affect childhood obesity. For example, phthalates and BPAs are found in plastics, and other obesogens are found in toys, cookware, and cosmetics. The green shades are the non-chemical stressors that affect childhood obesity. As a state, we are heavily affected by childhood obesity. In Florida, 17.8% of our youth ages 10 to 17 have obesity. This gives Florida a ranking of 9 among the 50 states and DC. Below, we have a chart that gives us the rates of obesity from the years of 2016 to 2019 in Florida.